Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, April 2nd, and this is my daily briefing. Right now in Missoula, we are now up to 17 cases. That's up 3 from yesterday, and there are 227 cases in the state of Montana. There have been 5 deaths in other counties. Today's briefing is going to focus on some of the questions that we've gotten over the past few days regarding quarantine and what the governor's order means. So quarantine, why follow it if I feel fine or my test is negative? First, we want to review what quarantine is. So quarantine is when a healthy person is asked to stay at home because they may have been exposed to COVID-19. That's different than isolation, which is when sick people are separated from other people due to known infection with COVID-19. People who are close contacts to a COVID-19 case and those who have traveled outside of Montana are asked to quarantine because they were likely exposed to COVID-19 and could develop symptoms of the illness. And once you develop symptoms, then you can spread the illness. So if you were asked to quarantine, we need you to stay home for the full 14 days of the incubation period. The 14 days comes from the maximum incubation period of COVID-19. That means that you can develop the disease at any time during that 14-day period. Remember last week when I talked about the differences between flu and COVID-19? Well, the really long incubation period is one of those big challenges with trying to control the spread of this disease. So if you were asked to quarantine and you're well at the end of the 14 days and you're not having any symptoms, you do not need to go and get a test. That just means that you get to get released from quarantine and you can go on about your regular business. If you develop symptoms during quarantine, then we do need to get you connected with a healthcare provider, if possible, and get tested, and at the minimum follow the instructions from our office or a healthcare provider regarding isolation. We're also getting the question, if I'm asked to quarantine, can't I just go and get a test to show that I'm negative? And the answer is no to that for a lot of reasons. First, if you don't have any symptoms, you don't need to get tested. As we've discussed several times, that's just not the way that the test works. You have to actually be having symptoms in order for the test to be accurate. There's no good evidence that the test can detect exposure in advance of illness or assess someone's risk of developing COVID-19. The test can only diagnose someone who has a respiratory illness as having COVID-19. That means if you're in quarantine and somehow you get tested, a negative test result is not going to tell you that you're not going to still continue to develop the symptoms at some point after you have that negative test. So all it says is that on the day of the test, they didn't detect the virus in your system. So that's a pretty big difference, and that's why if you're quarantined, you have to wait the full 14 days, even if you feel fine. The other take home, which I am hoping that our community-minded listeners will embrace, are these. Testing supplies are still limited. So if you don't have symptoms and you ask for a test, you're taking a limited resource away from someone who needs it. And we're learning nothing about your own health in the process. So please leave the tests to be available for those who are having symptoms. The other thing is we need you to cooperate for the full 14 days. I get it that 14 days is a long time. Two weeks of not being able to go anywhere or see anyone is a long time. A lot of us have people who depend on us, but if we don't follow this process, you could really expose other people to this illness and continue the spread, which is what we're trying to prevent. Just that few extra days after you start getting stir crazy, waiting out that full 14 days is really going to make a huge difference. So we've gotten a lot of questions about how much spread do we actually think that we're going to see here in the Missoula County communities. We're connecting with an epidemiologist at the University of Montana to help us look at the numbers and to help us try to understand what we might be able to expect. Right now, we don't have good numbers to give you, and we really just need more data. What we can say at this point is that it's really important for people to continue to follow the stay-at-home order and follow any quarantine or isolation procedures if you're asked to do so by either a healthcare provider or by our nurses here at the health department. Sources have evaluated the number of people that each sick person can infect based on numbers that they've seen everywhere else in the world. And those numbers tell us that staying home and social distancing is vital to stopping the spread of this illness. So now I want to talk a little bit about the governor's order. Um, Earlier this week, the governor issued a mandatory quarantine for people who have traveled from outside of Montana. So what that means is that anyone who traveled outside the state, whether it's domestic within the United States or international, need to stay home for at least 14 days from the day that they return to Montana. The order also applies to tourists who are asked to quarantine at their hotel or their Airbnb or other short-term stay facilities. So if you're a tourist and you're staying in one of those places, you're not exempt from that 14-day quarantine period. It just means you have to stay there for that 14 days. Those traveling through without staying overnight, those here who are on business and traveling healthcare workers are the only ones who are exempt from that quarantine order. The National Guard is going to start conducting let me start that over again. The National Guard is going to start conducting temperature checks at airports and railway stations for travelers who are arriving into the state. Those with symptoms are connected to healthcare provider through a telehealth system. So they do a video chat with a provider. Even if you're not flagged for symptoms at those checkpoints, the quarantine order of you have to be quarantined for 14 days if you travel from outside the state still stands. So you still have to stay home for those 2 weeks. Or if you're here staying in a hotel or Airbnb or other short-term stay facility, you have to stay there for those 2 weeks. The last thing that I want to mention is that you can find our daily briefing along with a briefing from our elected officials on our Joint Information Center page at covid19.missoula.co. And it's just really important that you can kind of follow what is available on that page. Know that that's a good source, a good place for resources if you live in our community and you're trying to figure out, what resources are available to you. And again, I just want to say that I can't stress enough how important it is that everyone follow the guidelines that have been put out and stay home under that stay-at-home order. And we are all in this together. And the only way that we can slow the spread is for all of us to follow the same guidance. So that's it for my daily briefing today. You can subscribe to my YouTube channel. Be sure to click the little bell to receive notifications when a new video gets posted. You can follow us on Facebook. Just search the Missoula City County Health Department. We post a lot of really useful information there. You can visit our health department COVID-19 webpage, which is missoula.co/cvirus for more information. And lastly, if you have any questions, please feel free to call 258-INFO. That's 406-258-INFO. And that is manned by people from 8 to 5, Monday through Friday, and they can help answer any questions that you might have that I have not already covered or that might come up during the day that you just need to get an answer for. So that's it for today. Thanks, everybody. Stay healthy.